There's no escape from the noise. The air is stifling. The lack of space almost suffocating. This is a daily reality inside the emergency department.
So this morning, so far, it's very, very busy in here. As you can see, there's patients in lots of non-clinical spaces because the department's overcapacity. It means that patients are having to be nursed in areas that they wouldn't normally be nursed in. This is obviously quite distressing for patients too, and there's not a lot of privacy here, a lot of dignity for the patients in here.
Patient after patient after patient arrives. For some, the only space is on a corridor.
I wouldn't want this for any of my relatives, but you know, the staff are doing the very best they can to provide the care, the best level of care they can for the patients in these circumstances. But it's not. It's upsetting. It's distressing for patients.
Extremely busy, congested department currently in RVH and the Mater.
But behind the scenes of what might look like chaos, the juggle for space is carefully choreographed.
I'm asking that we will move 15 patients, Ciara, out of the department between now and 11 o'clock.
With teams constantly tracking arrivals and departures across the trust. And this is where that choreography is most critical, Red Resus, the most intense corner of the emergency department. As we filmed, all bays were full. When this critically ill patient arrived, they had to be treated quickly and removed to another area to make way for an even greater emergency.
Ready, steady, lift. You're in hospital. You're in the Royal Victoria Hospital.
Care under pressure. Still compassionate. Patients right outside the resus door are witness to much of this.
Absolute mad. It's like the same four walls. I can't go anywhere because I'm on oxygen and you can't get the lights down to go to sleep. So it's literally the same brightness. I'm right outside the resus room, so it's just constant.
How have you found being here?
A bit nerve-wracking at times, you know. When you're sitting here and you don't know who's going up and down past you now.
What is it like trying to rest here on this corridor?
It's okay, so it is okay. Oh, some people do like it, but
you've got a bed and...
Yeah, I've got a bed, that's it.
Why is it like this?
So winter is always difficult, and we're not unique in the fact that unfortunately some patients have to spend some time in a corridor, and we know that that is not the care that we would want to give from a professional point of view, but also for them, and we're working really hard to reduce that.
Would you like to be being treated on one of those trolleys in the corridor?
Of course not. It's not what I would want for myself or a member of my family, and that's why we are trying to reduce this in the trust, trying to move patients quickly out of ED.
As the search for space continues, more ambulances arrive. Staff free them up surprisingly quickly, having worked hard with the ambulance service to speed up turnaround times, an issue that is still a problem in some trust areas.
We know that any delay responding to a patient increases the risk to that patient. We know that can increase the lengths of stay that a patient experiences when they're admitted to hospital if they're allowed to deteriorate before they actually start getting definitive care. And certainly the risks are higher for anybody whose response is delayed or whose admission is delayed.
By mid-morning, the hospital's discharge hub is under pressure to find community care for patients who need additional support to leave.
Fortunately, regionally, we are short of care homes regionally across the system.
One of those patients is Betty, who has terminal cancer.
The equipment's in place, so all being well, you'll be getting home this afternoon.
After days of trying, the team has finally secured a care package so that she can go home to her family.
I have very, very good family, very, very good friends. I'm not in any way short of that, but I need to be in the company because you're trying to keep your spirits up and you're trying to be positive.
As one patient leaves, a bed becomes free. And the cycle continues, with many still waiting.
And Deborah joins me now from the Royal. Deborah, this yet again looks like a system under severe pressure. You've been talking to the Health Minister about these issues. What has he said?
I have been, Rose. Look, I told him exactly what we witnessed when we were in the emergency department, about those patients who were just lined up along the corridors, about the constant noise, the harsh lighting, and how it's so understandable that it can be very distressing for patients and for their families. Now, I found it a lot busier this time when we were filming in the emergency department than when we were there a couple of years ago. But I have to say, look, the staff were absolutely incredible. And it was very clear that the Belfast Trust has been working extremely hard to try and improve that patient flow throughout the hospital. But there are so many elements within the health system that need fixed to keep people out of the hospital in the first place, but also to speed up the discharge of those patients who are there. Now, Mike Nesbitt has visited a lot of emergency departments recently himself, and he agreed that this isn't how it should be, and he doesn't want it to become normalised.
Well, first of all, I'm sorry, because it's a suboptimal experience and it should not be happening. Secondly, I really appreciate the fact that they don't point the finger at the workforce, at the doctors, the nurses, the consultants. And sadly, this is happening not just in Northern Ireland, but in neighbouring jurisdictions.
Now, the majority of the patients within the emergency department are older and they are very frail. One of the nurses that I was speaking to said that she is extremely concerned that some of these older patients aren't coming to the emergency department because they're very concerned about the overcrowding. But she said it's so important that they do come to the emergency department if they need that care.
Deborah McAleese, thank you very much.